Hello, I'm Ben Dean, one of the authors of The Management of Thumb-Based Osteoarthritis, a multi-centre service evaluation project. This is a summary presentation just to give you the basics about what we've done and what we found, and I'd be very grateful if you read our study in full on the Bone and Joint Journal website. So, invasive thumb arthritis is common, big disease burden both in primary and secondary care, and very little is known about current UK practice, particularly in terms of non-surgical intervention. In this context, our aim was to gain a wider perspective of current UK practice, specifically regarding what non-operative treatments were patients undergoing and what type of surgery was most commonly performed in the UK. We recruited 15 hospitals from around the UK, 10 consecutive patients from each unit, yielding a total of 150 patients. Basic demographic data, details relating to non-surgical treatment and the type of surgery performed was extracted, and we also did a short consultant survey consisting of 4 clinical scenarios. So what did we find? Well, the key results showed there was significant variation in treatment across the UK. In terms of non-surgical interventions, 45% of patients received hand therapy before surgery, 53% had received splints, 81% had had 1 or more steroid injection, and in total only 32% of patients had received all 3 of those interventions before undergoing invasive thumb surgery. In terms of the surgery used, trapeziectomy alone was the most common in 53% of invasive thumb surgeries, while trapeziectomy with LRTI was used in the other 46%, with 2 patients out of the 150 having something else done. 1 of those was an arthrodesis and 1 was a arthroplasty. Breaking that data down further, there was no obvious trend in terms of the type of surgery being predicted by patient factors. It seemed that the same surgeons did the same operation regardless of different patient factors. So, in terms of moving forward, we would conclude there's a definite need for better high quality research, particularly in defining the effectiveness of current non-surgical interventions used in invasive thumb arthritis, and also in terms of defining which surgery is most effective for which patients. Many thanks for taking the time to listen to this. We hope you have time to read our study in full on the Bone and Joint Journal website. Finally, I'd like to pay massive thanks to everyone who took part in this project. I'm sure a lot of hours were spent gathering the data, and also I know a lot of time was spent synthesizing and writing up this study. So many thanks for everyone who took part and put time into it.